We are live here at HIMSS 2017, and can you please introduce yourself?
I'm Jonathan Hirsch. I'm the founder and president of Syapse.
Excellent. And what do you guys do?
So Syapse is a software company dedicated to improving patient outcomes through precision medicine. So what that means is that we work with hospitals and health systems and large physician groups to help improve their survival and outcomes for cancer patients, and we do that through the combination of software technology as well as genomic information.
And you guys are a startup?
We are a startup, so we've actually raised a Series A, B, and C round of financing. We were an AWS adopter early on, in the early days of healthcare in the cloud, and yeah, we've been cranking ever since.
Excellent.
Yeah.
Can you talk a little bit about kind of some of the benefits of your service and walk us through like details of what you guys do?
Yeah, absolutely. So we have a software platform that gets implemented to health systems, and there are 4 parts of the software platform. The first part is data integration. So we integrate clinical data from electronic medical records and other databases with genomic data from testing labs. So that's the first part. The second part is we provide decision support to the physicians so that they can understand what the right therapeutic options are for their cancer patients. The third part is we have a clinical workflow system that the physicians use at point of care. And then the fourth part, which I can actually show you right now, is the quality improvement and learning health system matrix, where we help the physicians use all of the aggregated real-world data about their cancer patients to understand what the right treatment is for the next patient. So I can actually show that to you right now.
Yeah, let's take a look. Yeah.
So I'm looking at a screen right now, and this is what we call similar patients. So this is all of the aggregated data on all the cancer cases from a specific hospital. And what this shows is the stage of the different patients with lung cancer, the top altered genes that they have, and the next treatment that the patient went on. And as a physician, this is really helpful for me because right now I just use my intuition and my experience rather than using the evidence base, the real world evidence base to guide treatment. So what we're doing now with this feature is we're helping physicians leverage all of the prior experience about their cancer patients to do treatment selection for the next patient coming in the door.
And it's more than just that one office location?
It's more than just that one office. So we partnered with Intermountain Healthcare, Providence Health and Services, and Stanford Cancer Center to actually launch a network called OPEN, or Oncology Precision Network. And what this does is it creates a national cancer data sharing network, and many other health systems are now coming and participating in this. So if you're a patient at a community health system in, let's say, rural Wisconsin, you're going to be able to have access to all of the data from all these other institutions.
That's incredible. Think about how many little edge cases there are here and there across the U.S., and now there's visibility across being able to link that data together.
And what's happening in cancer is that as we understand more and more about the genetics of cancer, the tumor types are becoming so much more kind of cut up into different populations. So it's not just breast cancer anymore. Breast cancer might be 50, 60, 70 different diseases. So as we have these what are called subtypes of diseases, you need more and more data so you can really understand the best treatment for the patient.
So that must be a lot of data inbound. Can you talk a little bit about kind of what AWS services you're using to power it?
Yeah, so we couldn't do this if we weren't on the cloud, and AWS was the obvious choice. And we actually started working with AWS way back when. We started working with you guys in probably 2010 at this point, and we were actually one of the first cloud-based clinical systems working with hospitals. So we actually paved a trail and blazed a trail into multiple hospitals and health systems for cloud computing. So obviously we use all your goodies, all HIPAA compliant, of course, so EC2, S3, etc. So we leverage a lot of that. One of the most important things for us is how AWS provides a HIPAA compliant environment so that we can actually partner with you guys and launch a cloud-based HIPAA compliant service. So it's been a fantastic relationship for the past few years.
Excellent. Well, thank you very much for the demo. Come check Syapse out. The booth number is in the tweet. And thank you very much.
Thank you.